Now I'd like to introduce you to Dana Woods. As the Chief Executive Officer of the American Association of Critical Care Nurses, AACN, Dana Woods partners with the organization's board of directors to provide leadership and strategic vision for AACN and AACN Certification Corporation.
Nurses meet us where we are, right? They know the science, but they have to know the art of knowing us as people. And they practice by scientific evidence and standards and all that good stuff, but they have to create this intimate relationship at warp speed. You know, I once heard someone say that in 10 minutes, a great nurse knows more about you than your family does. And I think about it, and that's personalization, right?
Patient centricity has only been at the core of a healthcare provider's mission when it complies to the industrial model of standardization, which ironically has been discussed a lot today, that has historically rewarded volume more than value. Is healthcare's tipping point in danger of moving farther away from patient centricity in its pursuit of transformation?
All of us share this vision to create a healthcare system that's driven by the needs of patients and their families. If this is what we're solving for, though, I think we'd all also agree, and we've heard that throughout the day, that our current system isn't built to do this reliably and effectively. The system still acts like we're solving for efficiency and profit margins, not for meeting patient needs. And not always for supporting the well-being of caregivers, which of course is especially vital right now. Business can't be the leading motive. People, individuals must be. As I said earlier, like in 10 minutes, a great nurse knows more about you than your family does, and a nurse should know more about you than anyone else on the healthcare team, because that's the way the nurse-patient relationship works. It's part of the nurse's code of ethics to know us well enough to advocate for our unique needs being met. And this pandemic has amplified the shortcomings, as we've all talked about, of treating healthcare as if it were a factory. It's also generated a lot of great innovation. A patient nearing the end of life with that family present isn't predictable. It's not a process that can be standardized. We want patients whose time has come to have a good death according to their wishes, not an efficient death. You know, we know people die on their own timetable. The important measure is the experience we deliver, not the labor hours it took to get there. We know how we would want to be treated if we were laying in that hospital bed. And it is not an easy problem. It will take a lifetime to solve, but we can transform this by solving what we're supposed to be solving for. And I think we have some great insight today on positive social impact has to be the goal, not a tidy bottom line or lean manufacturing.